I'd like to welcome everyone and call this meeting.
Sorry, Ms. White.
Again, I would like to welcome everyone and call the meeting of the Board of Supervisors to order. This evening, we're very privileged to have Reverend Alan Gray here, who is with the Royal Presbyterian Church, who will give our invocation, after which Christy Bryce will lead the Pledge of Allegiance. So, Mr. Gray.
I invite you to pray with me. Lord God, we praise you as our loving Father and pray that you would give us the faith to accept that grace so that we might be your true children, your sons and daughters, and to love one another with the love that you give to us. Lord, we pray in these days of deep divisions in our nation that peace might overcome violence, that a spirit of forgiveness would overpower vengeance, a spirit of reconciliation would defeat powers of division, that selflessness would replace self-interest, and hope overcome despair, love overcome hate, and may all experience the bold generosity of your eternal love, Lord. We pray, and we pray your blessing on this Board of Supervisors meeting. We're thankful, Lord, for these leaders, and we pray you bless them and their families, and bless our community, bless our Commonwealth, Virginia. Help us, Lord, to have an attitude of humility as we serve one another in love, that we might be guided by your example of servant leadership. Give us a spirit of respect and cooperation as we seek to follow your command to honor one another above ourselves. Lord, we lift up our fellow citizens of Smith County. We pray for your blessing on all our endeavors. We pray for our economy, that you help it grow and help us to foster and grow good jobs. We thank you for our small business owners, for our large employers, for all who work hard every day to put food on the table. Help us to flourish economically and to make wise economic decisions for the common good. Make us compassionate toward those who are less fortunate and all those who suffer, Lord. Help us to help them in ways that are constructive. Help us to teach our children well, and we lift up our schools, students, parents, teachers, administrators. Give them perseverance and creativity to meet the challenges of online learning. Give wisdom to all who are guiding decisions about when to start back with in-person instruction. Bless our first responders, Lord, some of whom are here tonight. Just bless them, watch over them. We pray for all the county employees, for our frontline medical personnel. Just keep all of them safe and bless their healing work, their works of peace. Bless our churches that they might be strengthened to serve and love others selflessly. Lord, we pray against the coronavirus, that you would diminish its impact on all our lives. We pray for all who are presently sick, and that you might bring healing. We pray for more effective treatment, for the creation of an effective vaccine. And we pray, Lord, that you use even these challenging and hard times to drive us to our knees and draw us closer to you and to one another, so that we can draw strength and encouragement to work together, so that we might see demonstrated right here in this place what is best and noble in each of us. Like a refiner's fire, bring us through this present trial, Lord, stronger for it. And give us courage to always do the right and godly thing, and the strength and self-sacrifice required to carry it out. We make this prayer not for our glory but yours, that your will be done, your kingdom come. In the name of the Father, and Jesus the Son, and the Holy Spirit, one God, now and forever. Amen.
Amen. Thank you so much.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we'll have the approval of the minutes from previous meetings. We have two different meetings that we will approve separately. First are the minutes for August the 11th, 2020. They're before the board for your review. Any comments?
Move to approve.
We have a motion to approve. Do we have a second?
Second.
A motion and a second. All in favor? The motion passes unanimously. Next, we have the minutes for August the 27th, 2020. Again, are there any corrections or comments?
Move to approve.
Thank you, Roscoe. We have a motion. Do we have a second?
Second.
Motion and a second. All in favor? Okay, we have 4 ayes and 1 abstention. The motion passes. Next, we will have the financial report from Lisa Richardson.
Madam Chairman, as of this afternoon, due to the holiday weekend, we have not received financial reports from the Treasurer's Office. I do have a couple of revenue summaries and expenditures to review.
Okay.
I don't have any information as far as bank balances and
Okay.
that type of information. You should have in front of you there a revenue summary for July 1 through September 8, 2020. It lists Fund 1 on the first page, and it shows it by separate funds. If you flip to page 6, there's a final total. It was budgeted we have revenue budgeted for this fiscal year of $94,209,332. So far, we've collected, the current amount was $795,834.55. The year-to-date amount collected is $13,993,552.50. leaving an uncollected balance of $80,215,779.50, or 85% of our budget. The next page you have is the expenditure summary, and again, it's broken down the same way. It's the amount of expenses that lists Fund 1 first, each additional fund thereafter. If you have any questions on any of the funds, we can talk about those. When you get to the final page, page 5, again, it was budgeted expenditures $94,209,332. We have current expenditures 7/1 through 9/8. I'm sorry, 9/8 of $3,464,179.10. The year-to-date expenditures is $7,915,373.59, leaving a remaining unspent balance of $86,293,958.41, which is 91.59% of our budgeted expenditures. You should have an additional report there, the AP comparison for September of 2020 as it relates to September of 2019, broken down by fund, by the department. The total for September of 2020 spent was $1,364,678.42. September of 2019 was $1,354,901.95, so we're pretty much on track, the same place we were this time last September. So it's about not quite $10,000 difference.
It's very close.
And unfortunately, that's all I have that I can present at this time.
Okay, thank you, Lisa. I will move on to the agenda next to the payment of invoices, which is on the additional agenda. Under the general county, there's not a total. I'm going to read these separately, and then we'll do one vote to approve all the line items combined. Under accounts payable, $1,364,678.42. Payroll, $730,000. Auto draft, rural development, $15,515. Utilities miscellaneous, $30,000. County administration fund, $5,000. Is there a motion to approve?
So moved.
We have a motion, do we have a second?
Second.
Motion and a second, all in favor? Motion passes unanimously. Under social services, we have an appropriation for $445,000. Do we have a motion to approve?
Move to approve.
A second?
Second.
All in favor? Under the schools operating, we have a total of $4,353,000. A motion to approve?
So moved. Second.
All in favor? Under the EDA fund, we have $36,970.
So moved.
Do we have a second?
Second.
All in favor? Under the Sheriff Department Fund, $3,864.72.
So moved. Second.
Motion and a second, all in favor? Under the Recovery Court Fund, $332.08.
So moved.
Motion?
Second.
Motion and a second, all in favor? And finally, under the CARES Act Fund, we have $966,184.
Move to approve.
A motion and a second?
Yeah.
All in favor? And that concludes our approval of disbursements. Next on the agenda is citizens' time. Okay, and no one has signed up to speak. Is anyone here who wishes to speak during citizens' time? If not, then we will close citizens' time. Under new business, we have a presentation today from Dr. Karen Shelton, who is she's the director of the Mount Rogers Health District, and we welcome you, Dr. Shelton.
Thank you very much for having me. Were you able to get okay, great, yeah, the presentation. Thank you very much. Well, thank you very much for having me. It's been a trying time with the health department. As you know, we've been totally covered in COVID pandemic response. So hopefully you received this one-page summary. Did you have that in your packet? It talks a little bit about the pandemic. It may look slightly differently. If not, I will get you copies. Okay, very good. All right. And so just wanted to go over a little bit about, as you know, Smith County, as has Southwest Virginia, the nation, as well as the whole world, has been in the COVID pandemic since February. And certainly the health department has worked daily since February in response to this pandemic. This one-page article outlines a little bit about some of the numbers for community transmission, as well as some specific numbers for Smith County. Toward the bottom, you'll see that Smith County had its first positive case on March the 30th. We haven't looked back. Since that time, we had a very slow start with only 13 cases in April and 15 cases in May. June was not too bad at 36. It did begin to pick up, but we did have 107 cases in July, and in August we've had more cases than we had all previously combined at 273. 61% of all of Smith County's cases have come during the month of August. So we have a lot going on, and details change daily. As you can see, these are details when we had to submit this report to you last week. They've changed even since then. But Smith County account today had 331 cases total thus far, with 29 hospitalizations and 5 deaths. The state has approximately a 7.7% hospitalization rate for all cases, with a death rate of approximately 2%. Mount Rogers Health District as a whole has had approximately 8.6 hospitalization rate for our cases and a 3.3% death rate for our cases. Smith County is close with that in hospitalizations. At 8.7% of all cases have been hospitalized, but only 1.5% of cases have passed away. Certainly each one of these deaths has been tragic of its own. Our pandemic sheet looks differently. Let's see, I have the clicker. When we talk about how do we diagnose these cases, we rely heavily on testing. Do I point it up here or back there?
It should be, the battery. Can you advance it?
Okay, we look at testing sites. We are blessed in Smith County to have several options for testing sites. Certainly, Ballard Health has provided a testing site at the Smith County Hospital. The Health Department also has a testing site, as well as the Saltville Clinic has a testing site. Rapid test sites include at least one of our local pediatricians' offices, if not more, along with the Saltville Clinic have rapid testing sites as well. Certainly, our neighboring Washington County has similar venues. Wythe County actually has probably fewer venues than that, but Smith County does have good testing opportunities here. Turn it on. Okay. That always helps, doesn't it? Okay. I think, okay. All right, we'll go ahead for the next one. Thank you. So we do have testing at our local Smith County Health Department every Monday, Thursday, and Friday. We do ask that people call for an appointment for that, mainly just so we can get all your information over the phone, so that when you come, you literally stay in your car. We can swab your nose and you drive away. We don't have any paperwork involved with that. We do test people who are symptomatic, or if you have been a contact to a case, or if you're concerned that you've been a contact to a case, we can test you. When we look at the metrics of how this is evolving throughout our community, that has even changed since the time of this printing last week. Southwest Virginia is in a time of sustained transmissibility. We've had a lot of cases in Southwest Virginia. We have divided Southwest Virginia into near and far. We're far Southwest Virginia, along with the Mount Rogers Health District, along with the Lenawisco and Cumberland Plateau Health Districts to our west. We now have a higher transmission rate than that chart indicates. I will tell you, just in our community, the trends that we're seeing, and especially in Smith County, we have had, we thought we had a lot of cases, and then the summer came, and with the summer came a lot more cases. People traveled, people were out and about. Actually, if you could go to the next slide, please. This slide kind of helps us to see what happened over the course of time, and this is thanks to Ballard Health. They've put together some great graphics. So we see as Virginia kind of closed down and we stayed home, we had very few cases. Some of our earliest cases in Smith County were due to travelers, and then we had some healthcare workers, and then it was a little bit quiet for a time. But then as things picked up, again, we didn't have that many cases in April and May, but as things picked up, the stay-at-home order was lifted. We did have a face mask order placed, but not many people were very compliant with that. And so as we got out and about more and were using no protection, we noticed an increase of cases. This was conjoined by Tennessee having an earlier opening than we did, and Tennessee started to see a great increase of their cases. They opened the beginning of May. It took about 6 to 8 weeks for Tennessee to really see that rise locally in Northeast Tennessee, but we've seen a direct spilling of that into Bristol, Washington County, and Smith County most wholeheartedly. And you can see some rising of numbers there toward the beginning of July, and then even as Virginia's stay-at-home order lifted and people were out and about more, we saw more cases locally. These number of cases have to do with the whole 21-county footprint of Ballard, so that does include Tennessee cases as well. So as people started to travel over the summer, we did have several vacation travelers, went to some of the hot spots and came back and gave it to their family and friends as well. So we've had a real increase of our cases through travel, just through people being out and about and that sort of a thing. We have had it get into some churches and to spread there. We have also had, most recently, we do notice that when we see an increase in our community, unfortunately, it can then get into our long-term care facilities, and that is really our most vulnerable population. We do expect to see an increase in hospitalizations and deaths when it gets into our long-term care facilities. GALACS went through a peak much earlier than we did throughout May and June, and had a lot of resultant hospitalizations and deaths resulting from long-term care facilities. What happens is it just gets into the community and people get it, including healthcare workers. They work, the people in the facility get it, they have a large number of cases. Some are asymptomatic and some have more symptoms, and again, unfortunately, deaths are associated with long-term care facility outbreaks. It then gets kind of back into the rest of the healthcare workers and then projects back into their families. So we see it really kind of spreading throughout the community in that way. So whenever we have cases that are positive, we do work with any business that they work with. We talk with the businesses. So when someone is positive for a case, we do what's called a case investigation. We talk with that person, we find out when did their symptoms start, we want to find out who have they been in contact with while they've been contagious, and we also try to find out where they have worked and any possible contacts at work that they could have been. We always get permission of the patient to talk with other people, and then we work with businesses to make sure that they have best practices in place, safety practices for coworkers. We work closely with the school system. We have been even before schools have been in place, but even as they're beginning to get into, they're virtual right now, but we still have teachers in school. And so as they begin to get back into school and as we look toward them coming back in person at some point, we do work closely with those school systems. We have other school systems around the district who have had in-person school already, and we work with them closely as well. So as we work with these systems, we work with their families, their businesses, and any facility, including long-term care facilities where we have an outbreak, we do work with them quite extensively as well. We can see what else is here for the slides. Next one. This looks at the Mount Rogers Health District in general. Like I said, we had a slow start, an early peak in the Gil Oaks, Grayson, and Carroll County communities that kind of ebbed back again, and then we've had an increase again just since the beginning, middle of July. It's been pretty much nonstop throughout, and again, especially in Bristol, Washington, and Smith, and now we're having an increase in Witt County as well. The Gil Oaks has finally slowed down. We're pleased for them. And this looks at Smith County. This next slide looks at Smith County specifically, as we had kind of talked about the slowish start and then the kind of increase that we've had, you can see, over the last month. So we work, there are some pandemic metrics which kind of go into this, in which we have worked with your school systems with rather extensively, and Mr. Ott receives these as well. But this looks at some local metrics as to what goes into making a locality have a sustained transmission. Basically, the predominant thing is number of cases. The more cases you have, it drives all of these other things. So you can see Smith County has had a great increase of cases over the last month. You can see the next one, our percent positivity. That has to do with what percent of tests that you do are positive. Right now, Smith County, that one shows a 9.3. It's probably gone up from there. But generally speaking, whenever you have more cases, your positivity goes up because you've got more people turning positive. So it has to do. The next, it has to do with outbreaks. And again, as we have more cases in the community, we have outbreaks. And outbreaks is 3 or more people within an area, and that can include businesses as well as healthcare facilities. And then the last one has to do with healthcare workers. And you can see we've had some increase in healthcare workers lately. So this does drive our metrics as far as how prevalent it is in our community and how likely you are to get it just by being out and about. Next slide, please. Thank you. This has to do with modeling. When is Smith County projected to peak? When are we projected to have a relief of this sustained transmission? And the modeling always comes with different options, and this has to do with how well our community does. How, as the pastor said, how well do we look out for each other? How selfless are we? How are we looking out for our neighbor? How well do we wear our face masks, stay home when we're sick, wash our hands, clean all the surfaces around us? How well are we at social mitigation to help keep this from transmitting to the next people? And if we do it really well, our peak looks like it'll be somewhere at the end of October. Again, a lot of people predict that with Labor Day having just occurred, we'll have a spike from that. Some people say 2 weeks. We traditionally see more of a 4 to 6 week time frame for those spikes to occur, which does put us around mid-October. And so if we don't do anything and just let it run rampant, we have the projection to have many tens of cases every day. We do know that, for this disease to abate, at this point there's no containing it, there is just slowing the spread. And part of what we work toward is slowing the spread so that when people do get sick, and the majority of people, you can look here and to see, with again less than 10% of our population being hospitalized, 9 out of 10 people that get this have a mild to moderate illness. Most people don't have that bad of an effect. But we know that the elderly do. If you're over the age of 70 and get COVID in our district, there have been 30% of all those over age 70 hospitalized, and 17% of all those over age 70 have passed away. If you're younger, in your 20s, I think actually from the age of 20 to 49, only 2% were even hospitalized and less than 1% died. So it does have a different impact. And for our children, less than 1% hospitalized and thankfully no deaths. So as we look at how we interact and what can be done, we look at these curves and see how we can help each other. And I had a train of thought going and it just went right out my head. You want to go ahead to the next slide, please? One of the things that can be done, if you go back one, there's an app called COVIDWise, and you can put it on your phone. A lot of people get concerned that people are tracking them, but it is not a tracking device. It is a Bluetooth-enabled thing that if you have it and other people around you have this app, that they can tell if you turn positive, you activate the code, and anyone who has been within 6 feet for more than 15 minutes during your contagious period will then get a notice that they may have been exposed to COVID. So it's been very much utilized in a lot of our universities for helping with that. We've encouraged Emory and Henry to have it for their students. And the general population, people can choose if they want to use it or not. It's certainly the more people that use it, the more helpful it is to alert people. Next slide, please. We also look toward our faith-based communities. We know that this is a difficult time, and we encourage our faith-based communities to continue gathering. We just want them to do it smartly, with the face masks and the social distancing and the cleaning and the hand sanitization. And we have talked with many of those, and many have been very helpful with that. There are some tools for businesses, and I don't know if you're going to talk a little bit more about businesses or not, but there are tools for business communities on the Virginia Department of Health website. Also, the Department of Labor and Industry has tools for businesses, kind of best practice. How do I protect my office in my day? How do I protect, my staff in my office every day? What are the best business practices that we can use? You are all doing great. You're wearing your mask. You're not socially distanced, but you're at least wearing your mask. and so, those things are very helpful. We, use the hand sanitizers as we come in. You have a screening coming in, so those are all great practices, so that's very good. But it does talk about different things that you can do within a business to make it safer. So the things that we have are not rocket science. Like I said, our job has been, you can go ahead and the next slide, please. Our job has been to slow the spread of disease. There's no stopping it at this point. We want to make sure that the people who do get very sick, but we have hospital capacity for that. And Mr. Tyler will talk a little bit more about hospital capacity. But what we have been able to do successfully thus far is to keep the numbers slowly growing enough that we have room in our hospital for all the sick people, and not just all the COVID sick people, but all the people who have illnesses that are not COVID. People with heart attacks or cancer or diabetes still need hospital care. People still need surgeries. And so we have to maintain some capacity in the hospitals for them to have that. So by our case investigation and contact tracing and vigilance, we've been able to keep the slow spread enough that we can have the hospital capacity. We also have been over time, in the few months that we had that was a little slower in Southwest, we were able to gain a lot more PPE, a lot more protection for our healthcare providers and even for other people, our first responders. To have that, we have also been able, are some treatments now available. People in other countries have experimented on treatments, and we have the fruit of that labor as far as knowing if a person is very sick in the hospital, how can we save that life? So that's been very instructive. And we're closer to a vaccine. The vaccine is right around the corner, whatever that means, and we are waiting for a safe and effective vaccine to become available to us. We are looking at possibly in the late fall, certainly by the first of the year. We will make sure that the vaccine that we have is safe for people to use, and we will have more messaging regarding the vaccine when it becomes available. The vaccine will be given out in a very tiered fashion, those at highest priority first, most vulnerable. And so we will be working with the federal and the state guidelines regarding the implementation of making vaccine available to the community. One thing that I'll remind you, though, is that flu vaccine will be of utmost importance this year. We have it available at the health department and many other venues across the county, so we highly encourage everyone to get their flu vaccine this year. Flu vaccine and COVID can look very similar. You may not know which one you have, and at least we have a flu vaccine for now, and then hopefully we'll get the COVID vaccine around the corner. But to have a double respiratory illness at this point would be very have a lot of very dire repercussions for many of our community, those in our community. So the things that we can do, and it sounds, like the simple things that we've talked about, but, wearing the face mask, socially distancing, washing your hands or using hand sanitizer, staying home when you're sick, cleaning and disinfecting all your surfaces, and, if you feel you have been exposed or if you're having any symptoms, to be tested as soon as possible. The faster that we find out that someone is positive and we can put them into isolation, find those contacts, put them into quarantine, that's how we slow and stop the spread of COVID. So I appreciate your time on that today. I don't know if you want me to go over any of this today, or we'll just schedule another time for that, or...
Whatever you'd like to do. If you're prepared,
I don't know if many of you remember about the Comprehensive Harm Reduction Program. Some of you were on the board when we talked about this past year. I know we have a new board since we went over some of these things. As we know, in Smith County, substance use has taken a toll on Smith County, as it has the state of Virginia and even our country. Many of you were on the board over the last 2 years as we talked about what Smith County could do in a positive fashion to help with substance use. What are some of the resources that we have? We have partnered closely with the hospital since the beginning with a community health assessment back, it's been 2 years ago now we started, and work towards resources within our community about what could be done. The hospital has a grant, and then they've been able to work within the hospital and many resources there. We were also able to, with the support of Sheriff Schuler and many others, talk about a comprehensive harm reduction program that we provide through the health department. This is a program that provides services for those who are active in their addiction, who are able to gain resources that might help them along the path to recovery. Through this program, we can help link people to medical care. We can help link people to behavioral health care, to other community resources such as food and housing. The way that we bring them in is that we do provide clean needles in exchange for their used needles. And by doing this, we're able to get many of the needles off of our streets and out of our community and disposed of in a safe and proper fashion. I have one of these if y'all would like to send those around. And then we have our latest outcomes from the harm reduction program. We have over 200 participants now with close to 1,500 visits. We do find that many of them have tested positive for hepatitis C, and that's something that we talked about when we went over the statistics for Smith County. We're able to arrange treatment for them for their hepatitis C and provide preventative services for HIV and other diseases that we have, such as hepatitis A and B, which are which can be helped by a vaccine. We also provide Narcan and have had, I believe I had seen over 58 overdose reversals with naloxone, and we've had many people begin on their path to recovery. So we're very thankful for this program in our community, where we can help those who are in active addiction, not on their path toward recovery, because you really have to meet people where they are with the things that they need at that time. If anybody has any questions about either comprehensive harm or about COVID in the community, I'd be happy to take them.
Dr. Shelton, Dr. Shelton, on behalf of Smith County Schools, I know we talk to you about every day, and I just want to thank you for your expertise and advice, because you've helped us a lot in making decisions and being accessible the way you are. So almost daily we talk to Dr. Shelton, so I want to thank you for your time and expertise in helping us out.
Well, we're happy to help. Thank you.
Dr. Ratliff?
Dr. Shelton, I have a question referring to one of your charts there, the one that says locality, specifically Smith County. You talked about the adaptive and the adaptive low and adaptive high.
Yeah.
It shows different curves. All three of them appear to peak about the same time and start down. Is that relative of hitting critical mass of our community?
Well, that's a good question. Whether that's, I don't know if there's a magic mark. I know that when I look at the different rates of transmission throughout the district, Galax hit 5%, and theirs kindly started going down. I don't think that's a magical number that the state has validated. That's just what I've seen. Most all of our other localities were well under 1% for the total number of population affected. I think hopefully it has to do, and I kind of call it the getting back to school time, when people start to get in a routine. They travel less, they're at home more. We don't have any sports to go see right now, so there's no reason to really get out and about. But, again, the effect of the summer and the Labor Day weekend hopefully settling down by then, and the continued work of the contact tracers and case investigators as things kind of run their course. We're all hoping for this downward trajectory. Unfortunately, you'll notice it's right when flu starts ramping up. So again, it's going to be very difficult perhaps to tell what all is going on. We're hoping not to even get up to that peak, but we're trying really hard to keep from it. We're having, close to 10 cases per day right now in Smith County, and so it's 70-plus cases per week. That adds up very quickly.
Well, I too have the COVID Wise app on my phone.
Good for you.
Being in the retail sector and the healthcare, I come into contact with a lot of folks daily, and I have yet to have a notification of a positive, potential positive path crossing, I guess is what it's talking about. I'd like to throw in something out for the rest of the board here. I have a colleague in another state that got involved in the hepatitis C treatment, and they pretty much bankrupted the New York Medicaid system treating it. So this is a very serious thing that she's talking about here, that we need to get in front of that as much as possible.
We have some good resources in our community that we've been able to work with. The Mel Lehman Food Clinic partnered with UVA for some treatment. The Saltville Clinic does treatment. We have a residency program down at JMH at the Ballard Hospital there that does treatment, as well as prior to COVID, we were very actively on the path of getting our community partners on board. COVID's taking us on a little detour. We know that many are suffering from their substance use, depression, anxiety during this time, even that don't use substance use. So we know in this population it's a particularly difficult time. But yes, thank you for your advocacy for that. And that's one thing that I think Sheriff Schuler and the board, when we talked about this originally, the economic impact of hepatitis C on this community, if they were asked to treat all the people that were positive, it would ran many millions of dollars. So we're thrilled to have this program and to watch our rates begin to come down. Unfortunately, rates are slow coming out, so we haven't been able to see. The program's been up and going about a year and a half now. Actually, we're closing in on 2 years, this winter, so about a year and a half, so we're anxious to see how these numbers are going to be looking for us. So thank you for that good word.
Very good.
Dr. Shelton, on behalf of the board, we certainly want to thank you for making yourself available to us. In my district and also other people in the county, my biggest question and angst that people have had are the reporting of numbers. And I know there's a lag time, so I had some comments today. I put it out before the meeting to say, what questions would you like asked? And one thing was, we want to know the number of active cases rather than the total. Now, I've noticed in Worth County, I have a board of supervisor who does a great job of reporting, so I have to assume, since they're in the same district, not largest district, that we're getting the same information. So
let me tell you what to do for that.
Okay.
So I think we work closely with the emergency coordinators regarding your active cases. And I think you've just had a change in your emergency coordinator, and I have not met the new one yet. Unfortunately, Virginia does not report active cases, and I wish that we did, because I do think it does a lot for a community. And Galax, per se, when they had so many active versus now, and they got this high rate, but the cases have gone down, but nobody knows because they don't have any.
Because every day I go to the dashboard.
Yes.
And of course it's cumulative.
Yes.
And I do know that other information is broken down. It is available. So I think that's a big concern of citizens, like when you're saying there's 10 cases per day or 70 per week. I think that helps them to get a grip on it.
Yes.
And to maybe be more encouraged to take more proactive, measures to prevent it. So like wearing a mask or whatever.
So the best way to go about looking at the active cases, and Mr. Udd or the emergency coordinator, whoever goes about this, the way that we've worked with our boards in the past in several different counties, if you look at the total number of cases, so for Smith County today, that was 331. People are in isolation about 10 days. So from the time that they develop symptoms, their isolation is 10 days, assuming that they recover on time. Some last longer. So what we have said is that your number of cases that are reported daily on the website, the number of cases for the last 10 days is an approximate figure of your active cases, and you can use that as the proxy. So you take your total number of cases and you take your total number of deaths, and you look at the number of cases reported in the last 10 days, and that didn't come out right. So if you look at the number of cases reported in the last 10 days, that is a proxy for your active cases, and that's what we have told the other counties that they may use. So when you go onto the website and it has the number of cases per day, if you go back 10 days, you would use that total as your number of active cases. And that's something that you can post on your website if you choose to do so. When we talk about recovered cases, that's where we take the total number minus the active and the deaths, and you can look at how many have recovered.
Yes.
So that's how we would calculate that figure. And that way you're using public information that should be reproducible for anyone who wants to do it day to day. There is sometimes a lag in the reporting of cases, has to do with as they come to us, and specifically if you have a long-term care facility outbreak, those cases are reported differently to us, and so it will sometimes take us a little time to get those into the site, which may shift your numbers slightly, but also because those are not active in the community, but nonetheless they are still important to the community because they are part of the community as well as all the employees as well. So using that last 10 days of cases will be a proxy for you for active cases. It will be approximate.
Okay. I know at one point when I had met with the coordinator previously, he actually had a printout. Now, how often do those printouts come out daily?
So we have a special...
It even showed the name and...
We have a special dispensation from the Commissioner of Health for a public health emergency that allows us to communicate with one person in the county, the emergency coordinator, regarding our active cases. And so that is for the benefit of first responders and their health. It is not for everyone to know.
But we would know that, we wouldn't have to know the names, but we could at least know the numbers.
You could know the numbers from that.
Yeah.
That does not include your nursing home numbers. That will not include your long-term care facility numbers. The long-term care facility is on that, but not the number of active cases within that facility is not on that page. Some communities have used that as a proxy as well. We report those out Monday through Friday, and Monday's result does cover Saturday and Sunday as well.
With the hospital, I guess the Southwest Virginia Mental Health, is that part similar to the nursing home?
So that's so the residents will be counted on the public website as entries. They will not come onto your emergency coordinator sheet. All employees are counted just as residents that reside in Smith County. If the employee of that facility resides in Wythe County, it goes on Wythe County's numbers.
Well, especially since we're on the rise now. Even the article in the Roanoke paper recently comparing us to Eastern Virginia, and our ratio was, right there. So that's very helpful. I think in moving forward, they'll give us some direction to have more immediate information to get out to the community. So
yes, thank you for that. And some communities, so when we talk about Eastern Virginia, some of what the Virginia Department of Health advocates is that if a community has active transmission, they can look at some factors that they could, I'm looking for the appropriate word here, could do for their community to decrease transmission. So like in Eastern Virginia, when they had the outbreaks, they recognized that bars were a huge problem for them. So they closed them at midnight and made sure that people were socially distanced within those facilities. Some other areas with a lot of college students went from gatherings of 250 down to gatherings of 50, and they made that a town or a city or a county ordinance. So there are things as a Board of Supervisors that you can do that are more regulatory for Smith County. My general feel in talking with county administration is that obviously we don't want to do anything that has an adverse economic impact. Right. So as we look at why do we have cases in Smith County, we look at things like churches, which we've had a huge number of cases from in Smith County. But we don't regulate churches. People need religious gatherings, so that's why we say we're not going to regulate the religious gathering. We just want them to do it more smartly. Right. So, and other things of living, people need to get out and about and do the things they need to do. They just need to do them more smartly. Mm-hmm. A young person may not have the effect of the disease, but as they spread it within the community, we have many other community members that do.
We have a large aging population demographically.
Yes.
So
that's where the Board of Supervisors can be involved in some messaging. We do have a messaging campaign planned for the Southwest, and we would love any input that any of you have regarding messaging and media and what can we do for our community. Like I said, I don't see us cutting off the bars at midnight. I don't think that's a huge problem for Smith County. The other thing that we see is, we don't regulate protests, and we know that we had a large number of protests in Smith County over the summer, and I know that a lot of communities said they didn't see any cases from the protests, but I know that we had a lot of cases related to the protest, not only in Smith County, but in surrounding counties. We don't regulate protests, and we don't regulate religious gatherings. So, we just advocate that they do them smartly. And so the other big thing that we see is family gatherings. People have their Sunday dinners, they have their weddings, their funerals, they have their family gatherings, and we don't regulate those either. We just want people to live their lives more smartly and to do what they can to stop the spread of disease.
Right. Any other questions from the board? Again, thank you so much.
Thank you, Ms.
Okay, next on the agenda is a presentation from Mr. James Tyler, who's Vice President of the Smith County Community Hospital, Ballot Health.
First of all, thank you for allowing me to be here. As with most organizations, things happen, and at the top, you're probably the last to know of things that are going on. And so what I would like to impress upon this board is the amount of collegiality and interaction that all of us have in this county, and it's to the betterment. So when Dr. Shelton talks about working with the hospital and working with businesses and things like that, none of that would have happened if it hadn't been for a group of people looking to try and do things for the betterment of this county. So we've had the sheriff involved, obviously, the county administrators involved, several people are involved. And as a result of that, there are things that are occurring in this county that better prepare us for such things as COVID-19 or the drug problem or any of those things. So I wanted to be able to start out my presentation with saying that. Nope, it doesn't want to work. Let's see, no, that's there. Off. It's on, but it doesn't want to work. Okay, move forward, next one. As far as tonight, I wanted to go over several different types of things. First of all is just an update on the hospital, and there are three basic areas that we can go over. The financial performance, the quality metrics, and then finally the patient satisfaction metrics. Now, I hear all sorts of rumors all the time, so I'm going to dispel the rumors tonight. The hospital is not closing. Ballard is not going to close the hospital, and you'll understand why in just a second. You go to the next one after that. Financially, Smith County Community Hospital for fiscal year 2020, which starts for us July 1, we had a profit margin of 15.7% on a budget of 4.1%. We're about 11.6% greater than what was budgeted. At Francis Mary Manor, we had a margin of 3.7, or the budget margin was 3.7. We ended up with 14.7, or 11% excess in budget. You don't close a business that is contributing those dollars to the overall good of the corporation. It defies business sense. One more. These are the quality metrics, and these are standard metrics which Medicare, Medicaid gather to look at to evaluate hospitals. And in that far right column, you see the 90th percentile. Very few hospitals operate in that 90th percentile. There's only one measure that we are not operating in the 90th percentile, and that is C. diff. And that is a hospital-acquired infection that you can get at the hospital. Unfortunately, our rates are so low that we're talking about small numbers here. So If we're only talking about 20 or 30 potential people and one of them gets it, it'll give us a ugly-looking number, and that's what happened. So for the entire physical year, all of our quality metrics were in the 90th percentile. There's not too many hospitals that can do that. You don't close a hospital down that is performing at that level. Next one again. This is off Center for Medicare and Medicaid webpage. And this has to do with the different categories of patient satisfaction. So you have hospital performance, you have actual quality, and then how do people feel about the service that they are getting at the hospital? I handed out to you an article which I just received today. And these are the numbers that CMS published just recently. There's about 3,400 hospitals nationally that participate in the Medicare program, and all the ones that do get rated. And so when you look at that, they have a 5-star rating. So 1 star all the way up to 5-star. In this country, there were only 266 of those 3,400 hospitals that were rated 5-star. There's only one in Virginia, and it's right here.
Congratulations.
Yes,
So,
congratulations.
again, if you look at all three of those things together, you've got good financial performance. They all go hand in hand. You've got exceptionally good quality, and then you've got exceptionally good patient satisfaction scores all the way around. From a business perspective and from a Ballad perspective, you don't close the hospital down. I mean, this is one of your shining stars within Ballad. Now, are we making the same amount of money as a JMH or a Bristol Regional or something? No, we're a smaller hospital. But I want to impress upon you how well this hospital does and in relation to others. So, are there any questions about that? The next thing, talk a little bit about Ballad and Smith County and what we have done with COVID-19. Obviously we work very closely with the health department, but Ballad Health stood up their incident command center in early March of this year to start dealing with the COVID-19 pandemic. We receive daily reports from the Incident Command Center, and I distribute those to community leaders, and to Mr. Utt gets those, as well as Dr. Shelton and Sheriff Schuler and a bunch of other folks get those, that data. If you want to receive it personally, let me know through Mr. Utt, and I'll be glad to add your name to the distribution list. If you want that information. On Ballad averages about 100 COVID-19 patients at any given day in all the 21 hospitals that we have. Now, one of the things that we did in early July is that we redeployed some of our nurses to other hospitals, and there was a reason for that. Number one, for example, at Smith County, we don't have a pulmonologist here. We don't have a full-time cardiologist here. We don't have all those what I refer to as ologists here at this hospital, but we offer very good care. We have not lost a single COVID patient that we've had in our hospital at this point in time. But the corporation wanted to redeploy team members to other hospitals because they had availability of other specialists, and especially those that deal with signs and symptoms associated with COVID-19. So pulmonology is a real big one since this is a respiratory disorder. And we did that. In the beginning of August. We redeployed 12 team members. 11 of them went to Johnston Memorial, and 1 went to Bristol. We will be recalling those team members back at the end of this month. And part of the reason for that is that we have seen the cases, and as Dr. Shelton said, if you look at all the ballot, they've kind of evened out at about 100 cases. We were initially looking at the surge capacity that Dr. Shelton talked about, that one with the 3 different lines going up like this. We were looking at anywhere as a low of 60 at any given day to the high of 300. Well, even with all the beds that Ballard has, 300 would have been a huge task on our resources. So we've been fortunate in that we have been able to keep about 100 in-house at any given time and successfully treat those. And so for all of that, I am very, very grateful, and we'll be redeploying those back. So one of the things that we did is that we capped our inpatient census. So on the med-surg, we capped it to 7 patients, and the reason how I came up with 7, we look at every surgery day, and we have about 2 admissions from surgery every day, so we wanted to be able to have room for those. We wanted to be able to look at our normal admissions and discharges and how we can do things, and so we came up with that number of 7, and then on our inpatient rehab unit, we have 7 as well. But at the end of this month, we'll be pulling those back and to be able to function. Can you go to the next slide? This is one of the slides that Dr. Shelton referred to, and it's for all of Ballard-wide, all of our primary market area, and you can see it here, and obviously this information changes every day, twice a day, and I try to get those reports out to y'all. But we have seen an increase in the number of cases here. So if you go to the next slide, this is kind of a rendition of what Dr. Shelton was talking about. You can see this is a spreadsheet that I personally keep, which talks about the number of cases per day, and if you go back the 10 days, you can kind of get your average number. On my sign down at the bottom of the hill of the hospital, I'm going to be, I've been putting up for the past 7 days. I could put the last 10 days if you want. It just 7 days seem to be like a good number. But you can see, I mean, 2 days ago, 3 days ago, we had a number of 18 cases, which is the largest single day that we've had. I think we had 14 today that were listed. So we can go from there. Last of all, I've been reading a lot about the 1918 pandemic, and I've come away with 2 kind of things, two takeaways from it. Number 1, the country survived the 1918 pandemic. We will survive the COVID-19 pandemic. Number 2, the economy rebounded, and disaster didn't fall upon us. So while we're going through all of this now, it's hard to see some of the forest for the trees and the like. But those are the 2 things that to me are hopeful. And to say that we as a country, we will survive this, and the economy will survive it. Are there any questions that you have for me specifically? Yes, sir.
I don't want to monopolize the questions here, but I've got several I'd like to pose. What is our average daily census at the hospital? How many patients do we have at any given day?
Well, we've restricted it now. So normally, we would have anywhere from 17 to 24 in-house at any given time on a 44-bed hospital. So we restricted that, artificially suppressed that right now because of staffing and redeploying our staff.
So what's the rate of transfers to one of the other hospitals?
We normally do in a month about 40 transfers in a month. That is up this month because of bed capacity, and then redeploying our staff. You've got to have staff take care of patients. So we've had about 60 transfers this past month.
How many of those are ER visits?
Almost all the transfers come in through ER visits, with the exception of a patient who is up on the floor in med-surg, who starts to decompensate, that requires a cardiologist or a pulmonologist or a nephrologist or any other ologist that there may be.
Okay, and your maximum capacity for beds in the hospital is
44. 13-bed emergency department.
44, okay. Does anybody else have any questions for us?
No, please go
With
ahead.
your permission? Urgent care, let's talk about that for a minute.
Certainly.
I work in retail pharmacy, so I hear some very unflattering things referencing the hospital. And I'll be the first to tell you, I've been your shining advocate telling them you need to use them. I personally have used your hospital for bilateral knee replacements, and I wound up in the hospital with an infection a month ago due to a cat scratch. Have nothing but glowing remarks for the staff up there. They do a wonderful job. But the rank and file that I run into is, well, I may as well go to Abingdon or Bristol because that's where you're going to ship me to anyway, which is, makes sense my question, how many transfers? So the urgent care, I see a lot of patients tell me, I don't have a primary care doctor. Either nobody will take them or they've been fired by all of them, whatever.
Right.
And they wind up using the ER at an extremely high rate
Certainly.
for primary care. So my question is, on the urgent care, when are we going to see those hours expanded to address some of the non-life-threatening acute care that the ER is designed for and see more of a runny nose, sniffling, sore throat kind of thing that the patient needs, or the patient needs to get in and be seen?
Number one, let me kind of give you the answer. The urgent care is temporarily closed now because of, again, the resources and trying to marshal those resources to the best places was a decision by ballot to be able to do that. The urgent care here had restricted hours, and part of that, and I'm not going to make an excuse for it, I will say that my predecessor was the one that actually negotiated that contract and the hours that it would be open. We are going to, when we reopen it, we are going to extend those hours. So we plan to have 10 to 8 Monday through Friday and 10 to 6 Saturday and Sunday, just like it is now. It will be in the hospital. We want to be able to do some renovations to part of the hospital so that urgent care has a dedicated space. When the hospital was initially designed, they designed a visiting physician clinic. And so we have cardiology that comes from Abingdon. They see patients there. We have nephrology that comes. We have gastroenterology that comes. We have several different types of specialists that come to that clinic. The problem with just the physical design of it and having urgent care is that you had all these people who were compromised in some way, whether they're diabetic, whether they had heart problems, any number of things, and you don't want to intermingle those people who have the sniffles, could have strep throat, could have flu, could have COVID-19 in that same room. So we don't want to transmit any of that stuff. So one of the things that we have done, or that I have done in trying to address this issue of the urgent care, I want to start up again, but I wanted to have a dedicated space that we can separate those urgent care people and extend the hours on it. Now, we're talking about anywhere between $150,000 to $200,000 to do the renovations that will be necessary. And obviously, that's going to take Ballard being able to help pay for that. So we are in the process of doing the business plan. We've got the initial architectural renderings done, what needs current state, what would need to be demolished, and then what the final space would be. And I would hope, and again, this is just a wild projection, that sometime around the first of the year, if all the pieces fall into place, we may be able to reopen it at that point.
Okay. Circling back to this, I'm sorry, anybody else have a question before I?
No, that just concerns me a little bit because we're going into flu season, so.
Correct.
But probably you think the earliest will be the first of next year, okay.
Okay. In the absence of anybody else have a question, I have a couple more.
No, you're great, thank you.
Substance abuse programs, to circle back to that, there's a lot of talk in the community now about a proposed facility coming into one of our plazas here, and I've had people come in to me and directly tell me they're not in support of it, we don't need that element in this community. Now, I understand their point of view, but I tell them, would you feel the same if they were diabetic? The answer is no. So the question I have for you in Ballot Health by extension is it possible for Ballot to throw their weight behind a substance abuse program to legitimize, hate to use that word, but to legitimize a program of substance abuse, a medication-assisted treatment program, to help us reclaim a vast disenfranchised portion of our communities? Because once they get in this path, it's hard for them to come back. They face obstacles at every where they turn. They have to really, really work hard to succeed. Those that want to have a hard time succeeding. Combine that with the drug recovery court of the county, which is a shining success. We need to multiply that. And I think one way to pull that off is to get Ballot's credentials behind them and not have, I don't mean this in a bad way, but not have some unknown entity come in that may or may not be on the up and up. And find a way to...
Let me kind of answer first. A little bit of personal information. Prior to my career as a hospital CEO, I have a master's in clinical psychology, and at one point in time, I was a certified addictions counselor in the state of Virginia. And all the patients that I worked with, I never ever met somebody who said, it's my personal goal to be a drug addict. None of them said that. And I'm not going to make excuses as to why, but there is a problem. And so one of the things, and again, Dr. Shelton made reference to it, is the consortium that we pulled together. And we pulled together with the hospital a group of people, a group of stakeholders in this community to try and deal with this problem. It is not something that one entity can deal with. It's something that everybody and all of the county has to deal with.
Right.
And so that is what we are trying to do. With regard to treatment programs and not wanting those people in the community, I can remember when the Saltville Clinic opened, and that was part of the argument was, we don't want all these drug people in the community. Well, I was talking with Brian Haynes, and I said, Brian, I know you've got 30 people that you can treat. What's the demographics? And he says 28 of them are from Saltville and 2 of them are from Marion. They're already here.
Exactly, they're already here.
And it's not bringing undesirable people in. It is, what are you trying to do with the people that you have who have a problem?
Right.
And so, with regard to treatment, Bill Rush called me and wanted my recommendation on a potential person coming in doing medication-assisted treatment program. And I said, Bill, the easiest answer to that is have that physician get credentialed at the hospital. The credentialing process for any physician is long, it's arduous, it looks at every single stone and turns it over. It is something that, most doctors don't want to go through, but they have to go through. And so if you go through that amount of rigor to get credentials, you'll be pretty good. There was a group that Bill called me about a year and a half ago, and I said the same thing to him. Have them go through the credentialing process. And they didn't do it. They backed out. And so I give the same recommendation this time. Have them go through the credentialing process. If there's a problem, we'll find it. As far as Ballot Health and your part with that, your question with that is, Ballot Health is looking all the time and recently just received a rather sizable grant, just like the hospital got a grant to try and help with substance abuse. Ballot Health has, and that grant will look to try and start programs just as you're doing. So yes, it's definitely on Ballot's radar. Are they ready to pull the plug tomorrow? No, they're not. But things are moving in the right direction with it, and hopefully When I come next year at this time, I'll be able to tell you where we are at this process. You know, from an onlooker, it feels like a motorboat in molasses. The engine's really revved up, but we ain't going very fast. And that's the best way I can say. Progress is being made, and it's being made for the thing that I said when I first got here. We pulled together the folks at the hospital, and we were able to work together and do some things that have been very good and beneficial to this community.
Yeah.
We will continue to do. One of the things some of you were here when Chris McCarney did the presentation from Giles County. We want to continue to look at that and see if that's something that's viable for us.
Can I have one more comment, then I'll be quiet?
Yes, please.
I know we're here on State Hospital Hill, known for its mental health care, but there's still a gap in mental health coverage. I would urge you to take it back to the ballot higher-ups to at least look at doing a practice for mental health that would augment what's already here, not try to compete with, but augment, because there's several people in the community are falling through the cracks.
You know, one of the difficult things, and you know, Dr. Shelton could probably address this a little bit, is when we start to look at recruiting physicians, we have to look at community need. And if there is a need, so how many people in this county have diabetes, need a nephrologist, okay? And they pull all that data together. When you start talking about mental health, we have the wonderful state hospital right over there. But unfortunately, all those psychiatrists add up. And when we start looking at need and being able to recruit psychiatrists into this community, there's no need because of all the psychiatrists. They've got 10 or 12 on the books. And so that makes it very difficult to try and
But
recruit.
is that inpatient?
Correct. They're
I'm
not
talking outpatient.
They're
I'm talking
inpatient.
outpatient services.
It's the same type of figures. How many doctors do you have? How much need do you have? And then from that, we can recruit or we can't recruit.
Okay.
And it comes down to salary.
This
But I will tell you a couple of other things that are
offline.
happening. The School of Emory and Henry's Health Science, this time next year, will start a program, and they certified a licensed professional counselor in the state of Virginia. Will meet the criteria for that. Those people will be able to bill Medicare, Medicaid, private insurance as a licensed professional counselor. That is one avenue that is going on. Personally, I think the School of Health Science of Emory and Henry is such a strong economic driver to this community. And as it grows, this community will continue to grow and be able to get research dollars in here and the like that we don't have now. But there's such an opportunity here from your seats as well as my seat. I'm looking at these folks. I need physical therapists. I need occupational therapists. They have it. They've just started their RN to BSN program that they've just started now. So again, there are several numbers of businesses in this community. They're doing a lot.
Thank you.
Any other questions?
Mr. Tyler, thank you so much. It's been very informative and helpful, and thank you for taking the time to come and meet
And
with us.
again, I'll be glad to come
update us.
back anytime you want. If you want any additional information, just give Mr. Nope, hopefully I didn't break your email, and I will include you on that distribution.
Congratulations on your 5 stars.
Yes.
As I said when I sent the email out to my team members, this is not one person. This is the whole train pulling together. You don't achieve that by one person.
It's certainly good for the
Can't
community.
will it to happen, but very
Thank you.
good for the community.
Thank you so much. Next on the agenda is the Census 2020 update by Peggy Hawley.
Hello, good evening.
Welcome.
Thank you for having me here this evening. I will not take much of your time, but just wanted to give you a little update. Thank you, Lisa, for inviting me. Very hard to give updates during the COVID pandemic. Currently, here in Virginia, and I just looked at these numbers right before we came because you all's changed just a little bit, but currently in Virginia, we have a overall self-response rate of about 70%. So Virginia has taken off really well with people self-responding online, and especially during the pandemic. I guess this was a great time for that to be offered online. Here locally in Smith County, you're at a 60.7% census self-response rate, which means you've either probably already saw a lot of enumerators here, or you will continue to see a lot of enumeration here. Still, the Sugar Grove area is definitely an area to be concerned about. The census rates there are still very low, and unfortunately, during the pandemic, there's not been a whole lot. There's not been a whole lot of outreach that other than emails, a lot of social media, things like that has been done. Any kind of events or anything like that we had scheduled or going to happen, a lot of those were, as you all know, pretty much stopped. So anything that you all can think of in that area, there's one of the things that the Census Bureau is doing currently is called a Mobile Questionnaire Assistance Program. It's the MQA program. So in Southwest Virginia, we definitely, which, you're doing pretty good compared to, some of the counties. We have 3 counties in Southwest Virginia that we've been working really, really hard with, because their percent, even as 2 weeks ago, was still like 39%. So, you've done really well. It's, again, the Sugar Grove area. But we do have an opportunity for MQA staff to still go out into the communities. It does look a lot different. I was talking to Lisa today, giving them space and kind of putting them in an office, that ain't going to help us any in the area, because, we need to be where people are. So some of the suggestions for making MQA effective with a little bit of time that we have left is, if you have meal pickups within your county at the schools, that's a great place for someone to come in and sit outside. It's still keeping them some distance away. The Mobile Questionnaire Assistance Program, what that is basically is you've got someone there at the table providing information, but folks can use their own devices in order to self-respond. They're helping them do that. If something happens, they don't have a device, they can also just give the information to the MQA staff that is there. They can put it into the system, and even if we're in an area to where self-service or internet is not an option, our staff can put that into their phones, their tablets that they have, and whenever they come back out, once they hit service, all the information will update. So again, the schools is a great place if you have some opportunity there. Grocery stores, people are still going to the grocery store. The thing is, and I do know for a fact, Food City, because I've worked with a lot of grocery stores throughout Southwest Virginia, has just stopped any kind of sidewalk, folks are setting up. And, you can understand why that they do that. So that's kind of restricting us a little bit. But if you all know someone that'll let you come and do that, that's a great place. The health department in certain areas will let you come and set up. We've run into some HIPAA things there. So we've really ran into a lot of top places to get information out to. So if you all have suggestions, we still got some time, and we'd love to be here in the community doing something. I brought at least a few yard signs today to get out. I have a few bottles to get out, and a few flyers left. Do you have a question?
I was going to tell you, Mr. Griffin is over our meal distributions that we do in the school system.
Okay.
So if you want to speak to him, he can we do deliver a lot of meals to most all the homes, the people that requested. So
so you all are delivering meals?
We are.
Wow, see, that'd be really good. Is your school buses doing that? Is that what they're doing?
Yes. They sure are.
See, and that would be really nice. If we could get, flyers into those boxes, that would be a really good thing. Another thing, just having kids that are doing the online thing right now, and I have 6 kids at home of all grades, and I'm thinking, when my kids go back to school, I'm sending brownies every Friday. Because, just trying to teach is such a big deal. But just maybe talking to some of our teachers. I know that they're doing social study things right now, and they're really struggling to come up with some ideas. I think we've done good citizenship now for about 2 weeks. But, one of the suggestions I had is, hey, can you talk a little bit about the census? Because, I see a lot of parents running around in the background. And that may be a good way to catch their attention.
Peggy, when is the cutoff date?
Well, they've not really said officially, okay? What we were told a few months ago is that the census was extended out through October 31st, okay? That doesn't mean that you may see all of us here. As of right now, we are. However, though, I do know for a fact that the MQA events that I have scheduled will go through the end of this month. However, if we're going to do something, we need to be very active really quickly.
We still have a lot of ground to cover then, don't we?
A lot.
I'm curious if I can.
Sure.
Sure. So if we stay at a 60, 70, maybe we make it to 70, 75% response rate, what happens to the other 25%? Are there assumptions? Do you know what is there? I'm surely there's formulas out, but
Well,
what do we lose out on?
There's several things. We'll look at everything. I heard someone talk about, are you the emergency coordinator? Okay.
No,
Are you
county
not? Okay.
administrator.
Okay, county administrator. Well, any kind of funds, grants, anything you got coming here. Your roads, your education, healthcare programs, your WIC programs, housing. I know there's some low-income housing in Smith County right now, and a lot of people do come here. I was just told a couple of weeks ago by someone that gives out vouchers. They come here to get them with the intentions to go back, but they don't ever go back. Okay, so you all are keeping a lot of population that's not counted. And every dollar that comes into your community will be based on census numbers.
Yeah.
So they stop at the 75%
Schools and everything.
and we would show a 25%
Well,
population.
we're sending enumerations. About 4 weeks ago, there's about 11,000 enumerators that hit the field in the United States. They are out. They've actually came to my home, and I have a new home. I was real shocked that they even showed up there because we barely have an address. But they did show up. They are there. Folks are out and about. People do need to be, on alert, which we try to do a lot of that, even like on my personal stuff or whatever. I try to put information out. If you see an enumerator come to your house, here's how to verify them. Here's how to know if they're a true federal worker. We had an incident over in Buchanan County where 2 gentlemen went up to a certain location and tried to get into the people's houses. They actually did go into a couple outbuildings. And eventually when they got to, whenever our real enumerator got to like the 3rd house, that 3rd person said the same story and called the laws on them. So being able to identify a census worker is extremely important. There is information which I shared before, I can share again with you, of how to identify an enumerator. They can actually go in and put in their name and it'll give all their information. Lots of folks just don't answer the doors. I hear it all the time. I've even had relatives, and I've been at this for 2 years, and relatives, well, I didn't answer my door, and I'm like, what? I have to show you how to do this online now. So if you all have some opportunities, I'm all game, and again, it's hard to get in the doors. I can send hundreds and hundreds of emails out and sometimes never get a response. So if y'all have things that you all want to do, let's get those together. I will definitely tomorrow, I will reach out and we'll go ahead and do that. Anything you can think of that we can do to get out into the, out into the public. I'll pull, one of our, the MQA manager and I worked really, really close together. If you'll set something up, I reached out to her today and we'll make sure someone is there. So, any ideas that you all can come up with? some of the things which, not all of our libraries are real active, some of them are, some of them ain't. But they have those drop-off and pick-up dates, and we've been trying to catch people with those, because people are doing that. Your food banks here locally, that's a good place to catch people. There's more people going to food banks now than have ever did before. Even with my kids at home, I go pick up those, which we have to go pick ours up in Washington County, but I actually went today and picked them up. It is remarkable. The first week of school, I was like, oh, everybody, thank the school people. Because it is a big deal for a parent to have to stop in the middle of the day and fix dinner what time they're actually having to be the teacher, too. So it is a very big deal.
How many enumerators, if I may, Madam Chairman?
Sure.
How many enumerators do you think you'll have here in Smith County? Do you have one now, or?
They don't actually tell me that. I can ask questions to find out. I do know that, they were a bunch deployed in Southwest Virginia. Unfortunately, they send them to where the numbers are the worst. And right now in Southwest Virginia, so we're talking Roanoke down, Tazewell County, Lee County, and Wise County, and Buchanan County are the ones who are struggling the worst. But you have to look, you can, drive across the mountain and still have cell service or internet or something here. Last week when there was a mudslide in Buchanan County, we went down, my business did, to help go clean it up. There was absolutely no cell service, no internet, no anywhere, and nothing open. So they're really struggling. So I can ask to see how many we have. I can tell you they're still calling people. People think, we're this far out, they wouldn't be calling people, but they are. I know people who, have just applied. You have to look all the recruiting that we've done. Folks have moved on, And then the MQA program that we had that we were hiring folks for, when we went to start this up in March, COVID happened, and really until probably 3 weeks ago, we had been in our homes working since March. So anything y'all can think of.
Follow-up question, what Ms. Rutz asked. If we stay at the 75% and you don't contact anyone, they don't contact you, that is our number, is that correct? We don't, they don't factor in any unknowns into that number?
They will not.
Okay.
Wow.
No, but keep in mind that enumerators will be here for quite some time. And now afterwards, you still got some things that goes on with the Census Bureau. You got post-enumeration, okay? So even after all these enumerators are out there, you still got people who will go back trying to fill in those holes. So in other words, if they see a just magnificent drop in 2020 and then they see 2010 numbers and those just look whatever, you've got post-enumeration that's going in to try to clear those up. There'll be new surveys coming out, so you'll have those numbers in. But this count is the count, and it affects everything.
Is there a way you could get us some stuff that we could put on our Facebook and our website?
Absolutely.
How to recognize an enumerator or anything you could be, I can
forward the email I sent before, had 14, 15 different things on there.
It did, but doesn't have what Mr. Rutt's talking about specifically.
I've got one specific.
Got that?
After, we were doing it before, but after that incident happened in Buchanan County, I wanted to be very clear people understood more from that flyer. So I put together an email that I can forward to you, and actually, I think I sent it out in a group once before, that, I even included the link where they can click on the link and type in the person's name.
That'd be great.
So I can do that. So I can send that to you.
Okay.
Any other questions or ideas?
If not, Peggy, thank you so much.
You are so welcome. And I'll touch base with you. And if you all have anything you want to do, we'll do that. And I'll do this tomorrow.
All right.
All right, guys. You all have a good night.
Thank you, you too. And next on the agenda is the Memorandum of Understanding for Child Care Services. And do you have an update on that, Scott?
Mr. Rudd has that for you.
You have at your desk a printout. It's really just a one-pager. And just a reminder, this goes back to the CARES Act funds where we're partnering with the schools to help provide daycare services for the essential employees. The school board is taking care of school employee children, but so this will be, the nurses, the deputies, the folks that are out on the front line. We have set up a plan, and I'm going to admit, I'm leaning heavily on the school board and Dr. Carter for the majority of the information. But we've set up a plan to house 40 slots. It could be 60 kids because some kids may go Mondays and Thursdays, some may go Tuesday and Friday, but we're setting up 40 slots, not to exceed $25,000 a month. We've put $100,000, actually $120,000 aside, but just to as a placeholder in the agreement, not to exceed amount of the $25,000 really comes back to about $120, $130 a week. I can't remember the exact math, but it's in that range, so it's not overly exorbitant. The good news of what you get out of it is a very low ratio between just teacher-student ratio type deal. You get the mentoring, tutoring, the website or the internet availability and all that, and food. Of course, the school is taking care of the food and the internet. But what I'd like to recommend or request is approval of the memorandum of understanding and authorization for me to execute so that we can hit the ground running. I think the goal was to have this in place before the virtual ends, so that once that school starts, we have the child care facility. And I'll say they're hosting it at the Smith. I can't remember the name of the building. The building that's over in the industrial park that the school board has. With Education Center. Smith with Education Center.
It's just about clean the whole thing and everything.
And the goal is hopefully the program will be replicated on the western side of the county by the United Way funding after we get ours rolling. So I'll be glad to answer any questions if you have them.
If there are no questions, do we have a motion to approve?
So moved.
Do we have a second?
Second.
All in favor? Thank you very much, Sean. Under old business, next we have the class of 2020 prom donations. You want to take that?
Really briefly, in your packet, I said that there was a letter enclosed in your packet, and I was wrong, but you do have it at your dais. It was an awkward, you couldn't read it when we printed it, so we chose to do it this way. Anyway, so follow up on the prom discussion at the last meeting. Town of Saulville, Northwood High School, their prom coincidentally is Saturday night. So the timing is really good. They have a letter that they've put together. They're doing their prom outside in the downtown square where the stage is. I'm truly hoping that the weather holds out for them. It doesn't look too good yet right now, but they do have a need for the $400 donation. So I think they're good. I was able to connect with some parents who coordinated the Chilhowie High School prom that was held last month. That was funded by private donations, fully funded. So what they've asked for is that the board consider donating $400 to benefit last year's juniors, this current senior class, because the prom that they had last month was for seniors only, the class of 2020. The juniors of 2020 were not involved unless they had a date, I guess. But so they asked that the funds be provided to the Chilhowie High School with a note to benefit the current class of 21 prom or however they end up doing it this year.
Okay.
So that would be my recommendation.
All right. So do we have a motion to approve?
Move to approve.
Second.
Okay, all in favor? Thank you very much for all that information, and I'm glad that we're able to do it for these schools and these seniors. Next is a report from our county attorney, Scott Farthing.
I don't really have much to report tonight. We did file the petition to appoint the members to the BZA that you guys appointed a long time ago, that fell off our list. So that got filed with the court this afternoon before I came to the meeting. Though all three of those are being reappointed, so they serve until their appointment, the person replacing them is appointed, so they've all been appointed, and any action they may have taken is fine. But we are getting that order, hopefully be entered sometime this week, to reappoint those.
Good.
But that's all I have to report right now.
Okay. Thank you, Scott. Next is a report from the county administrator and staff. So, Sean?
This is kind of new. What I wanted to do is previously you would have had something, additional agenda items or something that pops up. I wanted to use this time for staff and for go ahead and talk about anything that pops up. So at your dais, you have a memo from me that has 4 items to talk about. One, we've already stated, I think you know that we have a full-time emergency management coordinator hired, Curtis Crawford. He currently does that position for Wythe County. He's a resident of Saltville, so he's coming home. And everyone that I talked to at Wythe County, it's good when they start talking about how they hate to lose an employee. If they're quiet, it started off quiet, but the last several days I've heard a lot of folks that have talked about how they hate to lose them in Wythe County. So I'm getting more and more excited. He'll be starting October 1st, hit the ground running for the EMS and COVID and anything else that pops up. A second item, you may remember a week or two ago, you received an email from Herbie Clay requesting consideration for a day of unity. I want to do some more research. I did want to have it on the agenda just to know that I'm working on it. But I think this is a much larger issue that needs some focus. So we'll have this as an agenda item in the future board meeting. Third thing is, every year, the Dawn of American Revolution asks the county to provide a Constitution Week proclamation. They've requested that the chair and I both sign the proclamation this year as representatives of Smith County. So we have the draft ones, and you have a copy of the draft in your attached to the memo. The Constitution Week would be September 17th through the 23rd, with September 17th being shown as Constitution Day. And finally, a request from the Commissioner of Revenue every year relative to the enterprise zone. The Board of Supervisors is asked to exempt certain properties from real estate taxes. It's basically a tax grant in essence. This year there are 2 properties that are still on the list, one in year 9 and one in year 8. And it's a 9-year program. So a total of $768.70 would be exonerated from taxes for the 2 properties. And you see there's a summary letter from Mr. Richardson and a copy of the action from last year, just for your information, as well as a summary of the investment totals. So I'd recommend that one would actually necessitate action by the board if you would concur.
Okay. Do we have a motion to approve?
So moved.
Do we have a second?
Second.
All in favor? So it passes unanimously.
And that's all I have.
That concludes yours. Thank you so much, Sean. Next on the agenda is supervisor comment time. How about if we start with you, Roscoe?
Yes, Madam Chairman. As you well know, my representative on the library board has resigned shortly, and I have a nomination of Ms. Heather Colley. She is a 15-year school teacher at Northwood Middle, and she is to do some student teaching this spring. It was put off one spring because of COVID, and she will have her master's degree in library,
Great, great,
and she'd be my nomination for that
great.
position.
So we have a motion, do we have a second?
I'll second.
Great. All in favor?
Madam Chairman, I will abstain from voting because she is my daughter.
Right. Well, we're
And I
glad.
was forced to do that.
We know how daughters are, but I think she'll be a tremendous asset to that board.
Thank
so
you very much. I'm very proud of her.
Yeah, thank her for offering to serve. We
I will
appreciate
do
it.
that. She's very passionate about Salva Library. She's took her son, who is now 11, since he was a babe in diapers,
Right.
to that library. And she's real devoted to it.
Well, I think she'll be a great asset to that
She
board.
dared me to ever vote against it in any way.
So you've got your orders now.
Thank you very much for y'all's consideration.
Beyond a doubt. Thank you so much, Roscoe. How about you, Mr. Sturgill?
I'd just like to say, in talking about the daycare, I ordered 100 hotspots from Verizon the other day, which we did a breakdown of students without internet service. Right now, we're presently doing jump drives 2 days a week and delivering them with our food services so they go to their house. However, in breaking down the students who do not have internet, approximately 75 to 80% of them actually live in self-service areas, so the hotspots will work to provide them internet. So those should be here towards around the 20th of this month. Like everything else in technology, there's a back order of everything.
Right.
And I did get 3 hotspots in today, so if the daycare starts before the internet is hooked up, we have internet for the daycare also. So we have a backup plan. If the regular internet's not hooked up in time, we have a backup plan to go there. So I'm proud to say, you heard them talk, we're delivering food to the houses of people. If they call and sign up for it, we're delivering food. So we're doing as much as we possibly can to make everybody get through this crisis as much as we possibly can. So I'm very proud of the school system.
Well, we certainly all appreciate all the efforts from the school system and the challenges they've faced this year, and you've been very successful, so you're to be commended on all that. This has been quite a year to try and juggle. I would just like to say I really appreciate, I guess, the county administrator arranging for the health department and for the hospital to be here and the census. I think those were great people to have come and give us information, very helpful. So I'd like to commend you all for all that you do for us, and thank you. And to thank the board for all the efforts. So that's all that I have. Mr. Atkins.
Everyone be safe till we meet again, is all I want to say.
Mr. Ratliff.
Not being here on Mr. Sturgill's first meeting, I want to welcome him to the board and
Thank you, Dr. Ratliff.
look forward to working with you. Also, I want to throw a shout out to our local law enforcement officers. We have one here, sitting here. I want to thank you sincerely for the job you do for the county and the citizens. I also would like to echo the sentiment Ms. Wyatt has conveyed for our county administrators. I think this was a very well put together packet. I appreciate all your hard work and your staff and what you brought to us. I also like the touch of the local clergy coming in and doing
I did too. Very nice.
the word escapes me, not benediction. Invocation, thank you. I'd like to see that practice continued and maybe spread the love around to the different denominations. I think that was a nice touch.
We've actually partnered with them, and it'll be a rotation now from now on.
I think that's well done, thank you. Yeah, I think that's all I can officially say publicly.
I think Mr. Sturgill has one more thing.
Let me say 2 things. Number 1, I'd like to commend the Board of Supervisors and County Administrator's Office for their support of the school system. And number two, I'd also like to commend our EMS services and our healthcare workers for the challenges they face every single day during this pandemic. And I think in our county, they've really answered the call well and done a fantastic job.
Exactly. We will have a continued meeting on September 24th, is that correct? And it will be at 7 o'clock, so... Are we going to do it at 5?
That's the public hearing.
Okay, so we will have it at 5 o'clock on September 24th. So until then,
So we're in recess. We're in recess.
right,
We need a motion to adjourn.
yeah.